Now let's talk about hip dislocation. Classification of hip dislocation. The most common is posterior dislocation, about 95%, and then anterior dislocation and central dislocation. Now clinical features of hip dislocation. Symptoms. There is a history of trauma of road traffic accident or fall from considerable height in flexed knee, mine accident or air crash, pain, deformity of the limb and restricted movement of the limb. This is a picture showing dislocation of the hip. Clinical features include signs like deformity of the limb, where shortening of the limb and hip is flexed, adducted and internally rotated. A hard mass due to depressed head in the gluteal region, restricted movement of the hip. There may be impairment of function of the sciatic nerve, vascular changes, arteria dorsalis pedis. General examination to see any other bony injuries like fracture of the patella and head of the femur, supracondylar fracture, chest and pelvic fracture can be done. Investigation includes X-ray of the pelvis including both hip joints in anterior-posterior view and oblique view, X-ray of ipsilateral femur including knee joint, and CT scan to detect acetabular dislocation. Treatment. Close reduction under general anesthesia followed by external traction post-operatively for 6 weeks and on starting of the active movements as soon as the pain subsides. After 4 weeks, non-weight bearing walking, and after 12 weeks, weight bearing walking should be done. Hip dislocation is rare because the acetabular cavity is deep, the joint is surrounded by strong muscles and ligaments. End of the topic.